Hello and welcome. Today, we're diving into the world of the urinary system to explore a condition called Struvite stones. These stones, also known as infection stones, can cause significant discomfort and complications. We'll uncover what they are, how they form, what the risk factors are, and how we can manage and prevent them. So, what causes these troublesome stones? Struvite stones are almost always linked to urinary tract infections, specifically infections caused by bacteria that produce an enzyme called urese. These bacteria, such as Proteus, Klebsiella, Pseudomonas, break down urine, a normal waste product in urine, into ammonia. This process significantly increases the pH of the urine, making it alkaline. It's this alkaline environment that sets the stage for struvite crystals to form. Now let's understand the process. The alkaline urine rich in ammonia combines with magnesium, ammonium, and phosphate, all naturally present in urine. These elements then precipitate out of the solution and crystallize, forming struvite crystals. Over time, these crystals can grow larger, aggregating to form stones within the kidneys, ureters, or bladder. These stones can obstruct the flow of urine, leading to pain, infection, and even kidney damage if left untreated. Regarding who gets them, struvite stones are more common in women than men, primarily because women tend to experience urinary tract infections more frequently. Individuals with indwelling urinary catheters are also at a higher risk due to the increased chance of developing bacterial infections. People with underlying urinary tract abnormalities that impede urine flow, such as vesicorectal reflux, are also more susceptible. The signs and symptoms of struvite stones can vary depending on the size and location of the stone. Many people might not even know they have a stone until it starts causing problems. Common symptoms include flank pain, which is pain in the side or back, often radiating down towards the groin. You might also experience dysuria or painful urination, frequent urination, urgency to urinate, and hematuria, which is blood in the urine, a urinary tract infection indicated by fever, chills, and cloudy or foul-smelling urine is a telltale sign that a struvite stone is likely present. Diagnosing struvite stones typically involves a combination of methods. A urine analysis can reveal the presence of bacteria, white blood cells, and elevated urine pH. Imaging techniques such as X-rays, CT scans, or ultrasounds are used to visualize the stones and determine their size and location. A KUB X-ray, which stands for kidneys, ureters, and bladder, can detect many but not all types of stones. CT scans are more sensitive and can reveal even small stones. Sometimes a cystoscopy, where a small camera is inserted into the bladder, is performed to directly visualize the bladder and urethra. While we don't typically classify struvite stones into distinct subtypes, it's important to acknowledge that their formation is intrinsically linked to infection. Therefore, the key factor differentiating them is the type of bacteria involved in the infection that promotes their development. Identifying the specific bacteria is crucial for tailoring effective treatment strategies. Treatment for struvites focuses on eradicating the infection and removing the stones. Antibiotics are essential to clear the underlying urinary tract infection. Stone removal can be accomplished through various methods depending on the size and location of the stones. Small stones may pass on their own with increased fluid intake and pain management. Larger stones often require intervention. Options include extracorporeal shock wave lithotripsy esavelo, which uses shock waves to break the stone into smaller fragments that can be passed in the urine. Percutaneous nephrolithotomy, PCNLE, is a surgical procedure where a small incision is made in the back to directly access the kidney and remove the stone. Finally, ureteroscopy involves passing a thin, flexible scope through the urethra and bladder to reach the stone in the ureter or kidney, allowing for direct removal or laser fragmentation. Prevention centers around preventing recurrent urinary tract infections. This includes drinking plenty of fluids to flush out bacteria, practicing good hygiene, and promptly treating any urinary tract infections. Individuals with a history of struvite stones may need to take prophylactic antibiotics to prevent future infections. In some cases, medications that acidify the urine may be prescribed, making it less favorable for struvite crystal formation. The prognosis for struvite stones is generally good with appropriate treatment. However, recurrence is common if the underlying urinary tract infections are not effectively managed. Recent research is exploring new methods for preventing bacterial adherence to the urinary tract lining and developing novel antibiotics that are effective against urese-producing bacteria. Furthermore, ongoing research investigates methods to alter the urinary environment, preventing crystal formation without significant side effects. These advancements offer hope for improved long-term management and reduced recurrence rates for individuals affected by struvite stones. Remember to consult with your healthcare provider for personalized advice and treatment options.